Cedarcrest Hospitals is a modern specialist medical care center located in Gudu district area of Abuja, Nigeria. Cedarcrest Hospitals, which is the brainchild of Dr. Felix Ogedegbe, was formed to bridge this gap with the aim of providing standard and quality healthcare services to patients within and outside the country.
Cedarcrest Hospitals has grown in leaps and bounds. We've developed a new 90-bed multi-specialty hospital center here in Abuja. Also built a new 20-bed hospital in Lagos, and then now actually in the process of commencing services in Port Harcourt. We have actually increased the range of services that we've provided to our clients. From offering orthopedic surgery initially, we now have grown into a full-fledged private multi-specialty hospital.
Cedarcrest had a vision of providing world-class healthcare in a local environment. And so our push is not from the hospitals around, because we're not trying to be like any hospital here. We're trying to make sure that patients don't need to go abroad to get an international standard of care.
By 2010, our practice expanded from orthopedics to include internal medicine, neurosurgery, obstetrics and gynecology.
We are able to offer not just routine gynecological surgeries like hysterectomies or myomectomies, pelvic floor repairs, suspension of pelvic organs that are prolapsed. We are able to offer key gynecological procedures like uterine fibroid embolization, which is treatment of uterine fibroid without having to open up the patient for surgery. So this is a form of treatment not common in Nigeria.
Cedarcrest Hospitals is built to international standards to provide world-class healthcare, showcasing the perfect blend of quality and affordability. Our hospital has a dedicated team of qualified and experienced doctors, supported by highly trained and courteous nurses, imaging scientists, laboratory scientists, administrative and ancillary staff who strive to make every patient's experience at Cedarcrest a pleasant one.
If a patient comes to Cedarcrest Hospital, irrespective of the problems, irrespective of the nature of investigation that the patient will go through, irrespective of the nature of treatment that the patient would demand, except in extreme cases, we want to be able to give the patient the maximum benefit of not having to go here and there.
We equally work with local and foreign visiting consultants from all over the world.
We have very good orthopedic team, and actually Cedarcrest is the hospital which is providing the world-class healthcare in Nigeria, and I am completely agree to this. We believe in work ethics.
Over the years, our hospital became first choice for patients who needed specialized surgery, particularly orthopedic surgery, neurosurgery, vascular surgery, and plastic surgery. Now,
Cedarcrest Hospitals offers specialist services covering internal medicine, obstetrics and gynecology, pediatrics, eye and dental clinics, radiology, rheumatology, ear, nose and throat surgery, dietetics, physiotherapy, and general practice,
including a 24-hour reception and emergency service.
So at any point in time, you have emergencies, whether road traffic accident or somebody who has just lost consciousness, they come to the emergency service, they have a doctor who can attend to them. Now, we've had pediatric services before, but now we have a dedicated wing in Cedarcrest Hospital. And the thing to note is the fact that we now have a neonatal intensive care units, and these facilities are manned by very experienced pediatricians and anesthetists who are in-house to render that care.
Our ultra-modern facility features modular surgical operating theaters, central sterile service department, high dependency unit, intensive care unit, recovery room,
and now installing a cardiac catheterization unit. Cedarcrest Hospitals has developed and incorporated within itself a central suction and piped oxygen system. Cedarcrest is also into medical manufacturing. We have an oxygen manufacturing and a prosthetic plant.
Our hospital is built with a helipad for transportation of patients to and fro our facility. Cedarcrest ultra-modern laboratory and radiology units, which operates 24 hours, are well equipped to deliver quality and standard services.
For the eye clinic, I call it a one-stop practice for both optical and ophthalmic practices because we take care of all your optical needs. So we are talking about anything related to glasses, we are talking about your contact lenses, and then going to the ophthalmology part of it, we do both medical and surgical ophthalmology.
We have 4 departments of dentistry, which is restorative, orthodontics, oral health, hygiene, and of course the x-ray. Then from there, as you can see from here, we have the dental chair, then the x-ray room, which consists of OPG, which is kind of the total mouth and the total head of the patient.
Our clinical support services include physiotherapy, pharmacy, prosthetics and orthotics. In collaboration with international partner Autobach, we have completed our prosthetic workshop, which is equipped with state-of-the-art prosthetic and orthotic plant for manufacturing of prosthesis and orthotics.
It is very interesting to note that Cedarcrest has made a huge investment and has acquired from us a modern, complete orthopedic workshop, which has been installed. And our plan is in the next 1-2 years to have brought it at a level where we can do everything we do in Europe here at Cedarcrest in Nigeria.
Cedarcrest Hospital is built to meet the needs of patients within the country and across the globe by delivering the highest standard of care.
We believe that Nigeria and Nigerians deserve to have highly specialized care. So while others may make do with what they find in the environment, we don't. We go for the highest level of excellence.
As part of our corporate social responsibility and also as a successful private organization, we give back to the society through our Cedarcrest Gaius Foundation. Gaius is an acronym which means give and it will uplift someone.
At the moment, we're focusing a lot on children with disabilities and deformities that can be improved with surgery. But more specifically, we're also focusing on children and adults with after effects of cerebral palsy, post-polio syndrome, and sickle cell bone and joint disease.
Over the years, less privileged citizens have benefited from our foundation. Having completed and fully equipped our facilities to world-class standards, we are now ready for a formal commissioning of the hospital.
I think it's a really big dream come true.
For us, it's exciting to watch Cedarcrest from where it came to where we are today.
I think it's about time that we let people know that such services are available locally. They do not have to travel out.
We wanted a tested environment that has been put to use with all the facilities completed, and at that time we told ourselves we'll be ready to do a proper commissioning of the hospital, and that is why we're commissioning now.
The Cedarcrest story is the belief that Nigerians deserve the best medical care system as what is obtainable anywhere else in the world, and where we have succeeded in providing excellent health care to a lot of Nigerians.
The Cedarcrest story is the Nigerian dream.